Good evening, good afternoon, and good morning. This is the 2056th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Anil Khurana. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. The purpose of this forum is to take homeopathy to every home around the world. We have already uploaded more than 3,600 videos on YouTube at IFPH Homeopathy. So those who missed the session can search at IFPH Homeopathy for watching the previous videos. So let me come to today's guest. And as you all know, today our guest is Dr. Anil Khurana, former chairman in CH and former director general CCRS. So we are lucky to have such a wonderful person in this session. And sir has more than 34 years of research experience, and sir has done a wonderful job for homeopathy during its venture as former Director General of CCRH as well as former chairman of NCH. So we'll be talking about updates of homeopathic research. So we proudly welcome you to this session, sir.
So good evening to everyone, and thank you for the organizer, IFPH, for a marathon of webinars, which they are continuing since more than 2000 days. Although this is a great achievement, and I hope my presentation will enlighten about the research which has been undertaken so far. Now, see, research has been continuing since Hahnemann's time. Hahnemann himself was a researcher in the way that he continued to evolve the homeopathic science throughout his life till his end. And by the end of his life, he even written the 6th edition of Organon, making certain changes into the further practice of homeopathy and into the principles. So it's a continuous process of evolving science through research so that newer innovations should come up. The science become finer and finer so that we can benefit the patients as much as possible through the system of medicine which we are now practicing. More than 200 years that homeopathy is close to 200. Homeopathy in 1839 it came to India, and now homeopathy is India is the world leader in terms of infrastructure, qualified manpower, research, and everything. Not so much of patronage has been given by the government of India in other countries by their respective governments. So we are privileged that we are now developing fast, and it has become the second most popular system in India after Ayurveda under Ayush systems. Although it is the first most practiced alternative system the world over after allopathy. But it is our duty that we should contribute to the development of this particular system of medicine in the way that we should contribute our clinical acumen through presentation of case studies in a scientific way, and that we have to do. But still, we are facing a lot of challenges for homeopathic research. I will be little moving faster because there are more than almost 90 such slides, but there are highly technical issues, so I will try to cover up as much as possible within a short span of time. Now, we know that there are challenges for homeopathic research because there are fundamental disagreements with established scientific laws. It is highly ultra-diluted medicine, which cannot be explained in the modern understandings of availability of molecules beyond Avogadro limit. And then there's a difficulty of conducting double-blind placebo controls trials due to individualized treatment. Every patient needs a different medicine. Although we can have a group of individualized treatment and then a placebo in other sites. So such kind of double-blind placebo trials are continuing, but there are certain ethical issues when we give placebo. Lack of standardized high-quality studies, and there are limited funding. But we are fortunate enough that in India, the government has provided so much of funding here that we have now about 32 research centers throughout the country under CCRH. And many other colleges, other research centers, they are also contributing in their own way. Other hurdles include publication bias. There's a lot of bias towards from the journals when they take up the word of homeopathy in their keywords. Many of them do not accept articles in their own journals. We have lack of trained researchers because not many years have gone by of undertaking such a research on understanding the modern technological research methodologies, statistics, and everything. And not many studies have been reproduced. And that's why there is a lack of evidence when they go for a systematic analysis or meta-analysis of these kind of studies. CCRH started these studies long back, since 1978 when CCRH was established. 1979 it started functioning. Since 1979 to today, a lot of studies have been taken up, although earlier these were not on a very highly structured protocol, but later on gradually the CCRH picked up those studies on a structured protocol, scientific protocols, and many such studies have been taken up. This is a simple example of a common prospective multicentric observational study to determine the usefulness of predefined homeopathic medicine in the management of acute diarrheal disease. And we can see from the very graph that with a homeopathic medicine, the trend of cure in children, different days of illness and the treatment. Many patients, they recovered from third day or fourth day, by the fourth day, and there was no mortality among these children, and they were treated with homeopathy. This was a simple observational study. Then another study of prospective observational study to study the role of homeopathic therapy in the management of diabetic foot ulcer. It has also been published in American Journal of Homeopathic Medicine way back in 2011. There were 63 cases were analyzed after treatment with one of the group of 15 predefined trial medicines. The improvement of the cases was assessed basing upon the diabetic foot ulcer assessment score. And there are documentary evidences of complete healing of this diabetic foot ulcer with a better control of diabetes with homeopathic medicine. There has been an evaluation of homeopathic treatment in polycystic ovarian syndrome and a single blind randomized placebo controlled trial. This is how we moved on from simple observation studies to single blind and then randomized control placebo controlled pilot studies with a small sample size. So this is how the treatment was given, where homeopathic intervention along with lifestyle management has been shown promising outcome. Further comparative study with standardized conventional treatment on adequate sample sizes, that there we have to take up studies where we can have a comparative arm with a standard of care, which that is what is required as per the modern scientific norms. There is a homeopathic management ADHD, attention deficit hyperactive disorder. A statistically significant improvement has been seen in the quality of life of these children with a suffering from this ADHD. And this was a compared with the placebo group, where we have seen that there's a statistically significant improvement in terms of the individualized homeopathic medicine treatment group. It has been treated from pre and post and then compared with the placebo group. Now coming again, now this is the next step. There's a comparative trial with conventional medicine, where we have to compare with the, as a requirement of modern understanding of when there is a standard of care, that one group be given standard of care, and another group the homeopathic medicine. And then we could find out here that in the conventional group, means the allopathic treatment, the antibiotics were prescribed in 39, means 97.5%, and no antibiotics were required in the homeopathic group. So homeopathic patient did not require any homeopathic intervention, and they were equally effective in terms of their recovery. You can see this graph here. We have seen that almost similar pattern of recovery was there by the fourth follow. And this is a highly recommended study which was published in Homeopathy Journal. And if you read the editorial of they have recommended this a highly quality study taken up by CCRH. Another study, there was an open label pilot study to explore usefulness of homeopathic treatment in non-erosive gastroesophageal reflux disease, NEGERD. And in that case, we have also seen that the homeopathic medicines, 78 patients were screened and 34 patients enrolled having symptoms of heartburn, regurgitation, and at least twice a week having a GERD symptom, but they were not of erosive stage, and that's why we could find out that we compare with the quality of life scale also and GERD symptom score. Almost there was significant difference was found in pre and post treatment GERD symptom score, and it was statistically significant. Improvement was seen in 3 domains of quality of life: psychological health, and social relation and environmental domain. The findings are encouraging to open avenues for further studies on reflux disease, and that we have to now take up those kind of studies in the future. This is another a pragmatic open level study to evaluate the response of homeopathic treatment in vitiligo. And we could find out that a total of 361 participants enrolled, 266 completed 1-year treatment, 139 continued treatment for additional 12 months, and 62 participants completed their 3-year follow-up. And these were assessed on the basis of vitiligo area scoring index, that is VASI score, and then Vitiligo European Task Force VETF score. They were compared over 1 year, and post hoc test identified change in score for VETF stage as significant at 6 months, 12 months from the baseline. The spread score reduced significantly from baseline, as also the change in mean score. And physician global assessment was highly significant. So the conclusion was the extension of depigmentation in vitiligo and spread decreased significantly, along with improvement in quality of life with regular homeopathic treatment. Now coming to the next stage of taking up studies where we can integrate our system of medicine, homeopathic medicine, along with the conventional treatment. And this is a condition where an acute encephalitis syndrome, the children, they land up into the ICU in an emergency stage. They are suffering from very high pyrexia, seizures, and even they are not responding. Disoriented stage also. So in the stage of disorientation, seizures, and high fever, they immediately require ICU treatment. And then when we added homeopathic treatment, visualized homeopathic treatment to one of the group of these patients, and if you can see the results, they were very promising in the favor of homeopathy. There are 304 under homeopathic treatment, and under placebo means only conventional treatment, 308 patients. So they were a comparable group. If you could find out here the results, if you can see, the reduction in the death was 15% less in homeopathic group as compared to the only conventional medicine. And if you can see the good recovery in terms of there are no sequelae remained after that. And it was 80% in homeopathy group. It was only 50%, means 30% more good recovery in case of homeopathy. So adding homeopathy to the conventional medicine has added clinical benefit to these children. They are recovered in a very good qualitative manner, as well as then it has reduced the death. Mortality has been reduced significantly in that way. So these kind of studies, another study which was taken up as adjuvant homeopathy with usual care in the management of thrombocytopenia due to dengue hemorrhagic fever. And in that phase, it was taken up in a allopathic hospital where add-on homeopathy was given to patients with who are landing up to the stage of very low platelet count, and there are chances of having complications because of internal bleedings, that they require immediate hydration therapy, as well as we added homeopathic medicine to them, and if they require, whether they require any additional platelet concentrate to these patients. And if we see here from this graph, the jump in platelet count from the day one, if you can compare is the lowest level here at the side below the graph. In homeopathy group, the rise in platelet count was, the mean average was 19,401, while in placebo group, it was only 7,000. So there was significant increase in the platelet count on the day one. On the day two, it was almost say more than double. That was 41,000 in homeopathy group and 17,000 in conventional medicine only, placebo group. And on the third day, 54,000. So this is how these patients who reach to more than 50,000, they can be discharged. They are going to recover very soon. That's why availability of beds are made available at the time of epidemic, when there is an epidemic, dengue epidemic in Delhi at that time. So this way, adding homeopathy to the standard care has also given us a big achievement in the way that homeopathic add-on therapy or add-on treatment in the integrative management has given promising results in such conditions which require a tertiary care setup. Then there was another study was taken on comparison of conventional and homeopathic paradigms in treatment from 0 to 18 months, where we compared homeopathy as well as conventional group. So 100 total acute, we observed almost up to 24 months, the number of acute episodes and total number of sick days, and the cost of treatment. And we can see from this table also that under this follow, total acute episodes were only 105 in homeopathic group. In conventional medicine, these were 180. Total number of sick days were only 643 among these children, means from the day 0 to 24 months, and 1,361 under the conventional medicine. And then see the cost of treatment, it was significantly lesser as compared to the conventional medicine. So this is how we can compare our therapy, homeopathic medicine, with the conventional medicine or add on to the conventional medicine. In any way, homeopathy has given its promising results in that way. Then a preventive study of Epitorium prophylatum for preventing dengue fever was also taken up in Delhi during that epidemic period. The vulnerable population was distributed this Epitorium prophylatum 30C as a prophylactic medicine. And if we can find out the highlights here, simply, this is also published here in a homeopathy journal in 2025. If you can see here, the analysis was where the unadjusted protective effect against laboratory confirmed dengue was 72.78%, which is a significant in both sexes. So homeopathic meds has a significant protection rate, almost 72%, 73%. So there's a potential prophylactic measure against now dengue as suggested by the finding of this study. So these kind of studies can be taken up in future when we find out some genus epidemicus And we have seen that also in the time of COVID also. Coming to this COVID, during this particular period, many different kind of studies which are homeopathic prophylaxis, or whether the homeopathic intervention of people under quarantine, the objective to prevent the person going to symptomatic stage, then COVID positive persons who are asymptomatic, with the aim to get them seronegative, and the patients who are COVID positive symptomatic patients and are admitted for mild to moderate illness, and to give homeopathic intervention. So all these kind of studies have been taken up by CCRH. And if you can see, the arsenic album 30C was taken up as a homeopathic prophylaxis, and this was distributed in mass in the country by colleges as well as, and a proper research study was also taken up as a multicentric study by CCRH. And if you can see the results here, there was 79% reduction in COVID-19 cases in the medicine group over a period of 3 weeks as compared to the control. And the results were highly significant. And this is how our homeopathic medicines has actually reported a better protection in terms of that, although this was taken up for a further analysis at a later stage. And this is how this study has been published as a complementary medicine research journal. And here, this study has actually given almost a kind of a total protective effect for arsenic album 30C was confirmed was almost 68.22%. And in the arsenic album 30C group versus 42 cases with a 10,000 person weeks in the control group. So we have a significant protection rate with using arsenic album 30C. It was a promising study in that way that homeopathic arsenic has given actually strong evidence as a prophylactic medicine. And going to the individualized therapy as well as an add-on to the standard treatment of COVID-19, this was a study taken up was Chayu Hospital in Bhopal. Again, there was a significant findings in terms of that the patients in medicine group, means homeopathic group, got relieved symptoms 2 days earlier as compared to the placebo group, standard care alone. The resolution of fever was 20 hours earlier in add-on homeopathic treatment group, and there was 61% decrease in CRP levels in add-on homeopathic group. And the result was statistically significant in terms of their time to recovery as well as time to fever clearance and reduction in the CRP levels. So this is a study which was taken up in AIIMS Jhajjar near Delhi. And this was a homeopathy as an adjuvant to standard care in moderate and severe cases. So it was a single blind randomized placebo-controlled study. It has also been published in Homeopathy Journal. And if you can see here that this study has also given us promising findings or significant results in favor of add-on homeopathic group. And if you can see here, the mean Q score was decreased from 4.26 to 3.64, which was highly significant in terms of recovery. The mortality rate for the add-on homeopathic group was 9.7% compared with 17.3% in the add-on placebo group. So MOP2 scores were between the two groups also differed significantly in favor of add-on homeopathic group. So these studies have actually given there's a significant role homeopathy can play as an adjuvant to the allopathic treatment or any other conventional treatment or standard of care in cases where there is a limited results. And here, this is another study which was taken up in evaluation of COVID-19 treatment with adjuvant homeopathy in Gujarat state. It was actually taken up information from the hospitalized patients with COVID-19 in dedicated COVID hospitals in Gujarat and who consented to receive adjuvant homeopathy treatment. And they were reviewed retrospectively from their documentations. And here we can see that almost % of patients who improved by day 7 were almost nearly 80%. And they were discharged by the 7th day. So this is another study which we try to analyze whether because prophylactic Ayush medicines were being distributed to various and patients, in spite of that, if they get infected, what was their clinical outcome if they have already taken such a prophylactic medicine? And they were analyzed retrospectively through personal interviews of these such patients who have actually been discharged from the hospitals. And if you can find there that Ayush prophylactic medicines were associated with statistically significant levels of protection against COVID-19 disease severity. None of these patients actually gone to that stage, or they were clinically improved significantly when they, as compared to persons who have not taken any Ayush preventive medicine. We have also taken up public health initiatives. This was on primary teething, a very big comprehensive study in 2 districts of India, that is one in Odisha and one in Assam, and almost more than 90,000 there was sample size of such children. A kit was developed which was given to such children for their day-to-day common problems during the primary teething stage. And the children who received calcaria phos and other symptomatic management during, and the ASHA workers were trained and they were prescribed. And this study has also been published in Homeopathic Journal. And this has been, there has been a good outcome of calcaria phos as a medicine. And we have seen that after 18 months, most of these children actually they do not suffer from their day-to-day these common problems, as has been seen. Most of these children usually suffer from either from diarrhea or upper respiratory tract infections, and there was no mortality among these children because of these. Another public health program in a research mode was taken up on a national program for prevention and control of cancer, diabetes, cardiovascular diseases, and PCDCS, integration of homeopathy along with yoga and then lifestyle management. And this study has also been now taken up more than almost, if you can say, patient who attended OPD, almost more than 5 lakhs, 0.5 lakh such, and they were screened and they were given lifestyle managements, also outreach camps, and almost say 1,91,000. There were diagnoses of some common NCDs, almost 1,07,860, and people at risk of NCDs were almost 79,000. So out of these, the cases which have been documented till the end of the study were almost more 18,000 such, and there are many who actually took up yoga classes and they followed their lifestyle management accordingly. And we can find out there that there was significant improvement among these patients here in visual analog scale, showing improvement in their general health as well. Persons who are having at a pre-hypertensive or pre-diabetic stage, they actually recovered significantly. And this is the practice of NCD management through motivation and homeopathic treatment. This is how they were assessed, and they given their own feedback in such a way that, do you feel the improvement in your health condition? Only 4 said that in 0.2, not at all, but yes, to some extent, 44% of patients, and to a large extent, almost 55% patients. So these kind of information which has been gathered, that yes, homeopathic management, if they are taken up as in non-communicable diseases, along with lifestyle management, we can improve their quality of life. And if they are at the pre-diabetic, pre-hypertensive stage, they can be managed well. They can go back to their normalcy. Now, these were all clinical kind of studies, and this is another recent matter has been taken up, which has been published here in Homeopathy Journal, Complementary Therapies in Medicine in 2025. And this homogeneous excellence database was sorted out according to the inclusion criteria. They wanted to see the quality of whether in homeopathy research, are we going with the proper quality trials or not? And how many of studies? They made shortlisted 85 controlled clinical trials and 14 observational studies. And they reviewed them, and it is nice to, and we feel proud that from India, maximum studies were shortlisted. These 30 out of these 99 studies, 30 were from the India. If you can see this bar, a big bar, this is covering the almost 30 studies from Indian side. And the studies targeted a wide range of populations and conditions using a variety of different types of homeopathy. The most studies conditions among infant, children, and adolescents was immunological function. So the quality of homeopathic clinical trials has gradually increased worldwide, almost maximum which were now coming in the public domain are from the Indian side. So they found that the state of homeopathic research could be substantially improved in terms of internal, external, model validity. Strict adherence to reporting guidelines with attention to quality criteria during study design would likely result in most of the needed improvement. However, there is also a focus where to focus future research in terms of conditions, population, types of homeopathic studied. These focus areas would take many forms and would align with the. So we have a long way to go to bring such areas to focus upon such also parameters or like internal, external, and model validity, and find out all those things, criteria where these are scientifically acceptable, and more such journals should take up publications of this kind of study. So this is the first part of my presentation about the clinical studies, clinical trials, and we have come up to a nice way. Many more such collaborations are being taken up. Second most challenging area is about the basic research. Although there are many studies, but I will skip some of them. But the most challenging area before the homeopathic scientific standpoint is the implausibility, and is often cited as a reason for skepticism about homeopathy. And potentation, is it a demonstrable reality? These are some of the questions which are we are trying to find out. Many scientists are working on different domains to find out all those things. In that way, if we see the pharmacological information for the liquid form to the solid form, we are dispensing medicines through actually to the pellets. So all these things were taken up, and that's why fundamental basic research become a main focus area since 2005 onwards. And since last 21 years, many collaborative studies have been taken up with various national and international collaborations. And these are some of the collaborating institutes which are of institutes of excellence in their own domain. School of Tropical Medicine, Bose Institute, IIT, AIMS, High Security Animal Disease Laboratory, University of Madras, and many more. And many molecular-based studies epigenetic studies have also been taken up. These are some on different aspects of to find out answers to all these unanswered questions, or there are challenges as of modern time. This was a simple study which was taken over IIT Delhi, whether homeopathic medicines beyond the Avogadro limit, whether do they contain any original particles? Because this is a big question. Because beyond Avogadro limit means the 12C potency, and IIT Delhi could demonstrate that yes, there were particles of colchicum 15C, and they are taken up through scanning electron microscopy. Pulsatilla 15C has also given such a with a ultraviolet visible spectrograph. Yes, simple dilution. You can see here the graph which clearly indicate yes, there can be this change can be due to the presence of nanoparticles. Another colchicum 15C, and then another study which was taken up as on metal-based medicines through IIT Mumbai by Dr. Chikramne, Dr. Belare, and this has also been published in Homeopathy Journal in 2010. And Zincomet, Oromet, Stenomet, Argentomet, Platinomet, and Cupromet, they have been studied. And they could demonstrate that even in 30C and 200%, these nanoparticles are demonstrated being as presence in the homeopathic iodulations with TM and SEM. Another study which was taken on by Jadavpur University by Dr. Papyanandi and her team on Aurum metallicum, and they could demonstrate that yes, Aurum metallicum, that the model drug Aurum metallicum in 3 potencies was characterized by dynamic light scattering, zeta potential, field emission scanning electron microscopy, and energy dispersive X-ray analysis. And the results were that the study shows a decrease in particle size with the increasing potency, and the zeta potential values show a fairly constant value. The nano medicine Aurum metallicum was non-toxic at all doses of 6C, 30C, and 200C. The hemolytic percentage also shows that 200C is non-hemolytic. This is how these studies have been taken up in the past, and with one of the school, Department of Chemistry in Dayal Singh College in Delhi, physicochemical studies have been understood using extremely diluted solutions. Homeopathic formulation of sulfur in ethanol by using volumetric, acoustic, viscometric, and refracting index. These are different parameters. Like we could find out that with the 6C potency and then 12C potencies, and there's a plateau after 18C potency of density of sulfur particles which are there with a different kind of a physical and chemical properties. Ultrasonic velocity and adiabatic compressivity of sulfur has been different with the different potencies. Coming that as the physical nature of homeopathic medicine and biological effects of homeopathic medicine, if it is when compared to whether they are actually placebo or they are different from placebo, if they are biological active substances or not. And as we have seen that we took up a clinical trial on acute encephalitis syndrome, and before that, this was a study which was taken up in School of Tropical Medicine on Japanese encephalitis virus, JE virus. And they could demonstrate that yes, Belladonna 6C was inoculated on choriolentic membrane, and that it has inhibited the growth of Belladonna 6C here. And then they took up a animal model study with a different one. It was control group with cyclic mice, experimental group with a Belladonna 200 given for 7 days, and experimental group. And then after giving these medicines for almost 7 and 14 days, and then there were another control group. These cyclic mice were inoculated with this JE virus. They wanted to see whether these medicines have any protective effect. And we can see that Belladonna 200C for 7 days, there was a cyclic mice. They survived. Survival rate was almost 80.60%. And the survival rate in the case of experimental group 2, which was of 14 days, they were 79, almost kind of an equal. While in the placebo group, the survival was only 47.9, means 48%. So there was significant 30% more, 32% more survival rate when using, and that has now corroborated with a good amount of reduction in mortality. We added homeopathic medicines to the children suffering from acute encephalitis. Again, kidney stones in mice model, this was studied, and we could demonstrate through this that with a ethyl glycol, you can actually develop hyperauxilic state in the kidney, and these hyperauxilic state can be when you give Berberis vulgaris along with ethyl glycol. It has almost shown almost protective effect on the red kidney section. These are histopathology slides of those, and the blue slide, you can see that Berberis vulgaris 200C alone was here, so it was not harmful to the kidney tissue at that time. Again, Post Institute in Kolkata, these role of homeopathic medicine, cancer regression, regeneration of depressed immune system. A mechanistic study was also taken up in collaboration with Division of Molecular Medicine, Dr. Tanya Das and Professor Gauri Shankar Saab. They screened actually these on different cancer lines, homeopathic medicines, and they could find out that there are certain medicines which have actually shown a promising role as a they have actually, like the percentage cell death, which has occurred in Silesia, Moxol, Calcarea carb, and many other such medicines, they were significantly up as compared to the placebo. So they tried on animal model, and you can see that Silesia actually has given a protection from early ascites carcinoma, which was developed in the mice. But when you give Silesia along with this cancer cell lines, which were given to these mice, Silesia has shown protective effect that way. Then mechanistic aspect, they moved into how these medicines are actually taking up such a step, and they could demonstrate that Kalikarica actually induced apoptosis, means the cancer cell death, and it was actually taking up this through a immunomodulatory circuit in P53 dependent manner by down-regulating BCL vascularization. And Thuja has also given another mechanistic aspect, that is, it was contributing through reactive oxygen species P53 feedback loop by Thuja induced apoptosis. And sulfur has given another pathway of action, that was NF-kappa B P300 crosstalk in favor of P53 P300 to induce apoptosis. So these are, and then another study which was taken at Delhi in school, Department of Zoology, Delhi University, and against cervical cancers. And here also again, it has been demonstrated that yes, Berberis aquifolium and Berberis vulgaris has actually given promising results. Like the mother tinctures of Berberis aquifolium and vulgaris had the strongest cytotoxic effect, especially against HPV positive cell lines. Another scientific aspect on the biological activity was taken up with the AIMS Delhi Stem Cell Department by Dr. Sudeep Sen and their team. This has also been published in Journal of Ethnopharmacology. And you can see here that osteoblastic differentiation of mesenchymal stem cells with a symphytum. This has given strong evidence that how symphytum actually promotes osteoblastic differentiation of mesenchymal, so that there's a early union of bones at the fracture site. This is what we are practicing commonly. We are prescribing symphytum. This has been demonstrated very well by this. You can see here, these are the two different slides as compared to the previous one. There's a good density of osteoblastic differentiation of mesenchymal stem cells in the histopathic slides. And it has been further taken up a study on animal models, on the mice model, and we can see the artificial fractures were created. And we can see here 6C and mother tincture has given promising callus formation as compared to the control and another control alcohol as a vehicle control. So if you can see here, the bone tissue as marked at the right two bars. We compare this after 5 weeks, the strength of bones has increased significantly in the similar trend by 6 and mother tinctures. So COVID study has also taken up, and many other such studies. Nanocurcumin has been used as a, whether it can use as a intervention which prevents blood-brain barrier damage for Plasmodium burgei, to see that whether homeopathic medicine can work as a prophylaxis for malaria, or it can reduce the parasitic load in the blood. In that way, nanocurcumin 30 has also been taken up as a fundamental basic research. And here we can see that the fourth infected nanocurcumin 30 was treated, and the brain was totally protected as compared to the untreated and a potentized alcohol. So nanocurcumin has given those kind of results in that way. This is how the histopathology slides also corroborate that nanocurcumin in 6C potency has given those kind of. Now, these are some of the links which you can always find out, like which, if they are interested to go more into details of these kind of studies, IGRH and Ayush Research Portal are from India. Back issues are also there in IGRH. One can see through the archives. Even Homeopathy Journal from UK is also having that kind of a, you can see those studies in archives also. And Ayush Research Portal, ayushportal.nic.in. You go to this, you can find out those studies here. Select homeopathy and then particular domain area you want to see into, you can see that also. This is homeopathic clinical case repertory. Why I wanted to say about this? This is a platform which has been created by CCRH for the practitioners. They can upload their success stories on this homeopathic clinical case repository, which have, if they have done a complete documentation of their cases, especially for chronic or incurable or say rare diseases, if they have documentary evidence of good amount of recovery, they can upload their case studies in this portal so that they can, in the future, they will themselves be benefited of further analysis. And this is a free, but it is a peer-reviewed kind of a approach which has been taken up. Once you upload, these will be peer-reviewed and they are good in quality and documentation. They will be available on this particular platform and you can analyze their own information. Now, quality of medicine is a big factor. That's why there are a lot of issues which are being raking up at social media sometimes on whether homeopathic medicine, they are safe in terms of they recommend high amount of alcohol, especially in mother tinctures where they are given. So CCR has also taken up preclinical toxicity studies of these, some of the toxic drugs or commonly prescribed drugs in mother tinctures. And this is safety evaluation of Cesium has been taken up on zebrafish model, and further it can be taken up on higher animals. So in that way, it has shown that the safety of Cesium gembolina mother tincture at a low concentration means 1% and 5%, they are safe. But if you increase the concentration by 10%, they are toxic that way. So we have to be very careful, and that is why these kind of studies we should actually be understanding and be aware about these. And then we should also be aware about the pharmacovigilance factors, that if patients report to some kind of adverse effect somewhere, they should be reported to the concerned pharmacovigilance centers in the country. And then let's document all those things factually so that we are not being criticized being on spurious medicine or they are not safe in that way. Although by large, homeopathy is considered as safe and effective, but let there be a documentation that they are safe. So this was all from my side. Thank you so much for inviting me here. Thank you so much.
Sir, it's really a very good session indeed. And we really got a very good idea about the research work conducted by CCRH and how it is happening and what are the other associations which join with our national organization to take the research in a perfect way. That's why we got such wonderful persons at CCRH and National Homeopathy Council. Yes, sir, to my question, I would like to ask a question. We used to say that the homeopathy have wonderful research organization and setup and everything, but unfortunately, these things are not coming to our public notice. Why can't we publish such thing in newspaper or in other periodicals? What kind of such things are going on?
See, a lot of things have already been coming to the public domain in terms of that many a times certain things are coming into the public in the newspaper also, but they are not given that weightage because there is more and more such studies have to be actually gathered in that way. So there is a requirement of a metadata at the ground level. And that's why we have developed this particular homeopathic clinical case repository. And let's first our homeopathic doctors be convinced properly. Although they are treating, but there's a high amount of documentation is required to come into the public domain. when we come into, like we have taken up once, a homeopathy conclave or Ayush conclave was taken up. There was media was also there, and these kind should come up regularly on that particular part. And that's why now this time, if you could, homeopathic colleges, they were given 7 days time before this 10th of April to make people aware about homeopathic system of medicine, go to the public. Students were also taken up to the public. This was a kind of a 7 day. That was to bring kind of a awareness among the public also, and to answer their query also.
Sir, what kind of propaganda we used to view to the research work, and how much money, how much funding we get from central government for research work per year? Or is it a 5 year program?
Almost, see, there's a good amount of budget of CCRH. It increases by 10 or 15% every year, and depends upon the requirement of that particular year. They are demanding more. Infrastructure is now increased significantly in our homeopathic research centers. If you see in Kerala itself, that our our institute, NHRMIH, you can see that Mental Health Research Institute. It has now grown significantly. A lot of publicity has been given to that also. If you come to Delhi, near Delhi, we have in Noida, we have a good lab, basic research lab, animal house, even in Kolkata also, a state of art, animal house, basic research studies are being taken up. So our institutes are now getting strengthened with the time period, and more such studies. And now they are taking more and more such of collaborations with other institute of excellence, as we have taken up in the past.
Okay, sir. Now I'm inviting Dr. Saji Kudiyat, our Vice President, to join the discussion.
Thank you, Dr. Khurana sir. Thank you. Welcome
Thank you.
for webinars again.
Thank you.
I am in Philippines and it is midnight now, so I will not be opening my video. Thank you very much for coming
Thank
and
you.
giving a presentation on the most important topic needed for homeopathy at present regarding the research. And so I am not saying anything more now. Thank you for your appreciation and joining us.
Thank you. Thank you so much.
Thank you, sir.
Thank you.
Sir, what are the proposals put forward by the CCRS for the next generation doctors in research?
Say they are now supporting, say, PG students as well as undergraduate students. And I don't know whether any one of you have attended this time World Homeopathy Day in Delhi, in Vigyan Bhavan. Almost, say, around 100 students who were under short-term studentship program. They were supported and they were selected, shortlisted for their good quality research. They are taken up as a short project. And we have now they have also started promoting good quality research by the MD students, PG students. And this time, almost more than 37 such students were actually shortlisted. They have done a good amount of good research dissertation from their side. This is how they are promoting good quality research. And under NCH, I have already made it mandatory for every PG students to have a PG college to have a department of research, mandatory department of research in their colleges. That has become mandatory now. That will bring a good quality change in the colleges education sector, as well as to support those budding researchers on the colleges side.
Yes, sir.
Thank you, Dhanesh ji, and congratulations, sir, Dr. अनिल खुराना सर, बहुत बहुत बधाई हो। आपका चेहरा बहुत दिन के बाद देखे।
थैंक यू सो मच। थैंक यू।
हाँ, बहुत अच्छा रिसर्च वर्क, बहुत बढ़िया बताए सर। अपडेट ऑन होम्योपैथिक रिसर्च, एक्चुअली अपडेट बहुत अच्छा, शानदार। तो Very, very thanks, IFPH, whole IFPH team. Very, very thanks, sir.
Thank you.
Thank you.
Hey, thank you so much. You have been doing a good job of providing
Binoy,
that
do
kind
you-
of a information to
please,
all.
Binoy, do you want to speak?
Yes, it was a very wonderful session, Dr. Khurana,
Thank
and
you.
I see many of the very uh, valuable studies that shows the importance of the homeopathy and the effectiveness of homeopathic medicines. And I would like to see a follow up on those, like for example, the COVID scenario or the Japanese encephalopathy and those kind of studies which shows the result. From there, a public awareness campaign should be made. So we should a continuous, not just one. It should be a continuous effort so that our medical field or medical institutions can advocate those, and we can provide the necessary help to our needy. So we need continuous. We need a continuous effort on that front. We need to help our institutions to provide us those studies, maybe advertise or uh, or or hoardings or whatever. We need to make sure our public is educated on the benefits of homeopathic medicines, and we should drive that way. Thank you very much for the presentation. It
Thank you.
showcased the effectiveness of homeopathic medicines. Thank you very much, Dr. Hanna.
The research has to be actually translated into practice. That is
Yes.
the main aim. If you can't translate that
Absolutely.
research, it is meaningless.
Exactly.
So that is why,
That's exactly what I
like
meant.
Japanese encephalitis, dengue, and other things. So CCS has already written to the government of UP and other states that these are the findings. If these homeopathy can be taken up as a first line of treatment in such conditions,
Exactly.
it is a promising role, and that
Yep.
they should take up as a policy matter. Like Japanese encephalitis, they can go on distributing prophylactic medicine to the population, so that every time the reduction in that new emergent cases should drop in a time to come. So all these things are being continued, like in NPCDCS, non-communicable disease, homeopathy has a promising role. Why not to who are at the pre-diabetic or preclinical stage? Other thing in that case, high hypertensive, those should go to the homeopathy first. This is how we should promote homeopathy in that way.
Absolutely.
Yeah.
Yep.
Yes.
We need to make sure the other medicines also, not just we should add on. Like we proved that 5 cases homeopathy is effective, and we need to expand
Yes.
the scope.
The conditions where standalone homeopathy can also be given.
Absolutely.
That kind of studies are also going on, but we have to see whether we have to first get an evidence. Yes, yeah, homeopathic medicine can do this. Then ethical committees allows you to take up standalone. They will not allow standalone in such a acute grave conditions. So they first take up add-on and later on as a standalone.
Absolutely. Those kind of advocacies will help homeopathy a lot. Thank you
Okay.
very much.
Yes. Thank you.
Thank you.
Okay.
Thank you,
Thank
sir.
you.
Ghar ghar homeopathic, har ghar homeopathic.
Thank you.
Absolutely.
Thank you so much.
Thank you, Dr. Anil
Thank you.
Khurana,
All the best to everyone. Thank you so much.
Dr. Ambaresh sir, Dr. Binoy, Dr. Shaji Gudiyat, and those who attend the session this evening. Tomorrow we will have a session from Dr. Najib Ahmad, and doctor will be talking about my experience and experiment with other ADHD. So hope all of you will be joining tomorrow at the same time. Thank you all.
Thank you.
Good night.
Thank you.